Discussing sexual assault and rape on college campuses. So, how often does this really occur? 1 in 5 women in college experience sexual assault. It occurs at alarming rates across categories of race, ethnicity, sexual orientation, and gender identity. However, underrepresented groups often experience greater rates of sexual violence. 21% of transgender, genderqueer, and nonconforming college students have been sexually assaulted. However, these numbers may not be as accurate as they could be, for many people do not report their cases of assault. According to the article History of Sexual Violence in Higher Education, female victims were not likely to report the behavior to authority figures, including parents, faculty, staff, or other authority. Looking at some risk factors, alcohol consumption is a leading one. At least half of sexual assaults among college students occur after the perpetrator, the victim, or both consume alcohol. Alcohol causes increased aggression and an inability to interpret another person's sexual interest accurately. Peer pressure can also be related to alcohol consumption and cause a person to drink more than they are used to. Sorority membership can also be a risk. Almost a quarter of sexual assault victims were sorority members, whereas only 14% of non-victims were sorority members. Being new to campus is another risk. The first 2 years of college are the highest risk years, and the first few months of the school year are the highest risk time of the year. Off-campus parties can pose more risk to sexual assaults as well. More than half of sexual assaults against college women took place in off-campus settings. More than half of these women who reported incapacitated sexual assault said they were at a party when the incident took place. Moving on to prevention, many campuses are consistently working towards creating a safer environment for the students and preventing sexual assaults. Individually, some things we can do are bystander intervention, which can train and teach others to speak out against social norms. Further, we can teach healthy skills like social-emotional learning, safe dating and intimate relationship skills, promoting healthy sexuality, and empowerment-based training. We can also change the social norms to positive norms about gender, sexuality, and violence. As a community, we can promote a safer environment by providing campus security, building access, control, and video surveillance. Towson University, in particular, uses the Blue Light Emergency Phone System. These emergency stations are located all throughout campus, and if a student ever feels unsafe, they can press the button and campus security will come. As a community, we can also provide support for victims. We can provide staff that is well trained in trauma-informed response and charge the perpetrators responsible through the school policy. As a society, we can change alcohol policies to reduce alcohol on campus and surrounding communities. We can strengthen support, enforcement, and reporting by having a stronger student code of conduct and making reporting procedures easier to locate on school websites. We can also have social media campaigns to get the word out about sexual assault prevention. There are many forms of treatment for people who have been victims of sexual assault. For physical injuries, we can provide pregnancy prevention and management through emergency contraception and pregnancy testing kits. Sexually transmitted diseases are also a result of sexual assault physical injuries. Victims may contract an STI as a direct result of an assault, and if the tests are positive, patients can be prescribed treatment. HIV and AIDS is also a risk. Although it is relatively low, a baseline test is available. This is more common in male victims of sexual assault because they are usually penetrated anally. We also can provide emotional and mental support. Everyone handles trauma in their own way, and some victims experience immediate psychological distress. Others have short-term or long-term psychological problems. Counseling services can be individual, family, or group therapies. There are also formal or more informal support group. Group therapy is helpful to victims who have little or no existing social support. Looking at the history of sexual assault on campuses, the system has overall been poor, and the response to sexual assault on college campuses throughout history has not been adequate. There have been no standard institutional or state definitions of sexual assault and rape existing, and only about 1/3 of schools reported crime. Less than half of all institutions of higher education provided new students with sexual assault awareness, education, and acquaintance rape prevention programming. Further, due process procedures for the accused were utilized at only 37.3% at institutions of higher education. However, over the years, we have made many strides in forming better policies. Through the Clergy Act, which requires post-secondary institutions to collect data, report these to the Department of Education, and publish these in annual security reports. It has made campuses safer. Initially, this act was called the Student Right to Know and Campus Security Act. It was later renamed after Jeanne Clergy, a girl who was murdered in her residence hall at Lehigh University by another student during her freshman year in 1986. The Title IX Act, implemented in 1972, prohibits sex discrimination under any education program receiving federal financial assistance, was implemented. The VAWA Act, which is the Violence Against Women Act, means that colleges and universities can have access to funds to reduce crimes and improve response to crime associated with sexual assault, domestic violence, dating violence, and stalking. Lastly, the Campus Save Act was enacted in 2013, and it expanded upon the Clergy Act regarding reporting requirements, strengthened victim rights, and obligated colleges and universities to adopt training requirements focused on sexual assault prevention. My first social determinant of health is the environment. This plays a huge role in sexual assault on campus. Many schools are located in major cities or bad areas, so it can be very important for one to not travel alone at night and know their resources that are available to them for safety. The environment of universities or higher education has predominantly been male-dominated throughout history, and this can create a power-hungry environment for males, which can make an unsafe environment for women. Further, alcohol and drugs is a huge part of the college environment. Drinking and drugs has become engraved in the college setting, and findings recognize that college women routinely use alcohol and that it's positively correlated with higher incidences of rape. My second social determinant of health is access. Many college campuses have become more proactive in speaking about mental health. There are many more resources on college campuses that a person who is assaulted can turn to for help. Since sexual assault is very much a women's health issue that can cause PTSD, helping and treating that person's emotional health is of the utmost importance. Availability to treatment is essential in overcoming physical, emotional, and mental trauma from assault. The SASCA bill, Survivors Access to Supportive Care Act, was issued in order to establish nationwide standards of care for survivors and expand access to services. Title IX was enacted to prevent and address various forms of assault on campuses by implementing new policies, reporting procedures, and investigative processes. This has allowed access to receiving help. Lastly, social and community context is another social determinant of health that is related to sexual assault. The college life includes partying and drinking with peers. According to one article, the perpetrator is oftentimes someone the victim knows, and in many incidents, alcohol consumption is involved. Stigma surrounding sexual assault can also be of higher risk in a college setting. Most victims did not define their experiences as crimes, and thus were unlikely to report to police. Stigma surrounded around what determines a situation to be sexual assault has caused many women to misperceive their assaults and mislabel them. Further, they can be seen as weak if they come forward. Rape culture has also had a huge impact upon sexual assaults. Sexual violence becomes normalized and excused in society. Common traits of rape culture include objectification of women's bodies, encourage male sexual aggression against women, and behaviors may include victim blaming or criticizing women's appearance.